Well, here we go again. Coronaviruses are very common. They cause common colds, and every once in a while we get a rogue virus that causes much more serious disease. Your audience will remember SARS and then MERS from Saudi Arabia. Those were coronaviruses, and now we have another new coronavirus that's capable of causing serious lung disease. It's sickened over 40 people so far, two of whom have died. So the CDC is taking real precautions. All of this happened in China, in fact, in Wuhan, China. And so travelers from Wuhan who come to New York, San Francisco, and Los Angeles will be screened. And that's an entirely appropriate thing to do. A good precaution. Prevention, as Benjamin Franklin said, an ounce of prevention is worth a pound of cure. We don't really know yet whether this virus can be spread from person to person. We think it may have happened a couple of times already. So we don't want people coming into this country suddenly spreading it to people in their homes or at work, wherever they're going. So people coming off the plane will have to fill out a questionnaire. How do you feel? Have you had fever? Have you had a cough, etc.? And have you visited markets where they sell meat or seafood in Wuhan? Because we think maybe that's what the source of this virus is. And then, of course, they'll also use what's called a thermal sensor. They'll put that device on your forehead to see if you have a fever. Now, if you are positive in any of these ways, they're going to take you out of the line and examine you a little further. One of the things that may complicate this a little bit is, you and I know, we're in the middle of influenza season. So flu can give you a little bit of a fever. So nobody knows yet how many people are going to be asked to step aside for further examination, or indeed, we haven't heard publicly yet what the plans are for those folks. Will they be put into some sort of quarantine? The most dangerous, of course, was the SARS virus. It could be spread person to person. It made many healthcare providers very sick. So far, the healthcare providers in China have not caught this infection. So we're all crossing our fingers and toes, hoping that this virus is not readily spread from person to person. Understand that now globally, we're conducting surveillance for these odd viruses, and in lightning speed, the Chinese molecular virologists have actually identified that this was a novel coronavirus. Just 10 years ago, it might have taken us 3 months to do that. Now with modern technology, they can do it. And the Chinese investigators and public health officials are being quite candid and open in communicating to the world's public health authorities what's going on. You may remember that way back when in SARS, they were kind of quiet about that, didn't want to talk about it, didn't let out the information. But they're doing that now, and they get large compliments for both their technological skill in identifying the virus and also communicating their findings to the world's public health communities. High marks.